Well, now to your Health Watch. A new study from a Yale professor shows pediatric fentanyl deaths are rising sharply.
Yeah, we are joined now by the author of that study, Dr. Julie Gaither from Yale School of Medicine. And Dr. Gaither, we appreciate you joining us. And I want to ask you first, just to give us a sort of a 30-second synopsis of what you found in your research.
Okay, so with this study, I looked at deaths from fentanyl among children and adolescents, so those less than 20 years of age. And I looked over time from 1999 to 2021, and I found that there were approximately 5,000 children who died from fentanyl poisonings during this time, and approximately 38% of all opioid poisonings, or about 14,000 during this time, were from fentanyl. But as I show in my study, the majority of these deaths have occurred in the past few years. Since 2013, there's been a 3,000% increase in deaths from fentanyl among children. It's primarily older teens and adolescents, those 15 to 19 years of age, but there's a substantial number of young kids, those less than 5 years of age, that are also dying from fentanyl.
Yeah, that's really scary. And talking about that increase right there, how has the fentanyl crisis changed when it comes to these pediatric deaths? What do you account for that sharp spike?
Well, I believe it's a reflection of there's more fentanyl in this country, more drugs, prescription and illicit drugs are being cut with fentanyl. And so the majority of opioid poisonings in kids and adults occur in the home, and so children are more likely to be exposed to the drugs. And go ahead.
Dr. Gaither, would it be fair to assume that with the younger kids, the ones you're talking about 5 years and younger, those would be accidental ingesting of this fentanyl in some way? With the older kids, it might possibly be related to their drug abuse?
So, right. So with older adolescents, with teens, it really mirrors the way they are overdosing or being poisoned, mirrors what's happening with adults. So it's recreational drug use, or they have a substance use disorder, or they're taking the drug intentionally sometimes, and then they're overdosing. With the younger kids, it's more complicated. It can be that the child, like toddlers do, they're picking the drugs up off the counter, off the floor. And then when you have infants, these are kids that are not mobile for the most part. And so sometimes the drug has been administered to them. It's hard to tell with the data like these exactly what is happening. But yeah, it's just with the little kids, it may be that someone has given them the drug.
Certainly an alarming study, but important one for parents and anyone who's a caregiver or around kids to know about. Dr. Gaither, thank you so much for sharing the results of your study with us.
Oh, great. Thank you so much for having me.